안녕하십니까, 김경원입니다.
Greetings, I'm Dr. Kim Kyung-won. I'm honored to share my surgical clip with you today. The patient of the day is 67-year-old male patient, and the chief complaint was that there was mobility in the entire upper arch. On the right, there are implants in number 4 and 6 and bridge prosthesis, but there was significant bone defect around number 6, so it required re-implant placement. The patient did use RPD, but because of tooth loss and mobility, as of late, the patient rarely used it. Number 11 and 22, which were still there, needed to be extracted. Implants were planned for number 13, 11, 22, and 23 because I'm going to show you this later on CT image, but bone conditions were more favorable than thought. For the posterior area, bridge-type prosthesis utilizing number 24 and 26 was planned. There's only teeth up to number 6 in the lower. In number 26, OneCAS was planned. In the anterior zone, because this is a fairly long span case, vertical anchors will be used to fixate the OneGuide template. I'm going to talk about how to place implants without deviation. As for the anterior zone, slight flap elevation will be done. EOS collagen will be used for GBR. On CT, this is number 13. Overall, alveolar bone condition seems nice, but there's a bit of labial bone damage. On CT, it looks very thin, so I think there is slight labial bone left. Number 11, there is severe mobility, and for number 21, it's less mobile. Let's move on to number 22. More so than thought, the height and width of residual bone was okay, so implants were planned for number 22, 23, and 24. For number 26, OneCAS was planned for implant placement. I discussed the plan with OneGuide team. TS3 BA surface implant for number 11, 4.0 by 10. The same goes for number 13. As for number 22, although alveolar bone is good, 3.5 by 10 mm was planned for number 23, 4.0 by 10 mm, and for 24, 4.5 by 10 mm implant was planned for number 26. TS3 BA surface, 5.0 by 10 mm implant was planned. If you look at CT image, the distance from implant top to the inferior margin of the sinus was 5.35. Hence, minimum residual bone height was assumed to be 5 mm. Drilling would be done from 4 mm. The maximum residual bone height was assumed to be 7 mm. For number 26, TS3 5.0 by 10 mm implant was planned, and residual alveolar bone height was assumed to be 5 mm, and drilling will be done up to 4 mm. 3 mm stopper on 7 mm drill will be used, and the drill size will be expanded to 3.8, which is the final drill size. After sinus flora penetration, hydrolift, bone graft, and implant placement was planned. As mentioned earlier, this is a fairly long span case and it's connected to the posterior zone. As we use OneGuide template, please take note of how vertical anchors were used. On the bone twist, a drill was used prior to using bone anchor. Once implants are placed, implant anchors can be used as vertical anchors to fixate the OneGuide template accurately. The key is making sure that the implants do not slip in the anterior zone. This is image taken during surgery. In the beginning, you can utilize the implant in the upper right. I started to perform placing bone anchors from number 23. Template was fixated, and then I placed the implant placement in number 24. After that, implant anchor was used. Vertical anchors were placed in number 23 and 24, and implant was placed in number 11. I made sure no deviations were made. Implant anchor was added to number 11 and implant was placed in number 13, number 22, and 23 where bone anchor was placed, and for number 26, OneCAS was used to place the implant. This is immediate post-op image. Healing abutments were connected. In number 13, you can see on the labial side, GBR was performed, and in number 11, GBR was done also in labial side number 22 and 23. In the anterior zone up to number 23, labial bone graft was performed. This is number 24 and number 26, where OneCAS was used to place implants. This is immediate post-op beam CT. This is 2 months after surgery, and this is 3 months after temporary prosthesis was fabricated. As you can see, this was 2-piece prosthesis from canine to canine, and for number 4 and 6, bridge prosthesis was fabricated. 10 months after surgery, final prosthesis was delivered, and for 6 anteriors, 4 implants in the anterior zone were utilized, and this is the posterior side. On CT, after 10 months, labial wall was nicely maintained, and final prosthesis was delivered. Anterior and posterior implant prosthesis. Now we're going to look at the surgical clip. Please take note of how vertical anchors are utilized. Number 11 actually came out on its own. Peritomy was performed, and forceps was used to extract number 21. OneGuide template was adapted. It was nicely adapted. Tissue punch was used to remove overriding mucosa. Overriding mucosa was removed in number 13 first, and in the same way, in number 11, tissue punch was used. Next is number 22, number 23, number 24. Overriding mucosa was removed using tissue punch. In number 26, this was wide hole, so wide tissue punch was used to remove overriding mucosa. Template was removed. I've checked whether there was any remaining overriding mucosa, and then surgery was proceeded. Template was adapted once again. Vertical anchor will be used in number 23 first. I used the flattening drill first just to be sure. In number 23, flattening drill was used to full length. In number 23, twisted drill was used to place vertical anchors. Vertical anchors were fixated. Bone anchors were used. In number 23, the patient's left side is all distal free end, so sure fixation is necessary. This is essential in preventing any deviations in the anterior zone. Moving on to number 24, flattening drill was used first. In number 24, initial drilling was done, followed by 3.5 by 10 mm OneGuide kit to drill. Through pumping action, I made sure there was no bone heating. Next is 4.5 by 10 mm drill. In number 24, 4.5 diameter implant was planned. 4.5 by 10 mm OneGuide drill was used. Implant was placed first in number 24 TS3 4.5 by 10 mm implant. The implant was placed 80% using engine. The bone quality seems sound. Implant driver was used, torque wrench was used to get final position. Primary stability was over 30 newtons. After implant placement, implant anchors were used. Implant anchors were connected. Number 3 and 4. This means that there were 2 vertical anchors in order to ensure accurate implant positioning. Template was checked, and then moving on to number 11, flattening drill was done, followed by initial drill. Because the tooth fell out, I think initial drilling would suffice. In order to prevent any deviation on the palatal side, a 7 mm path drill was used to prevent any slipping. Because the palatal side was a bit hard, a 13 mm path drill was used. The plan was to place a 10 mm implant, and the path drill was used up to 11.5 mm. Next is 3.5 by 10 mm OneGuide drill. Drilling was done. In number 11, 4.0 by 10 mm TS3 implant was placed. Because there were 2 vertical anchors on the left and a tooth on the right, the template was fixated for sure, and implant driver and torque wrench was used to adjust the final depths and position hex. Primary stability was sufficient. In number 11, OneGuide implant anchor was connected. In this clip, I wanted to emphasize the use of vertical anchors, so I used it as much as possible. Now moving on to number 13, flattening drilling was done. Full length of flattening drilling was done, followed by initial drilling in number 13. This was canine area. The alveolar bone was slightly sloped. In order to prevent any slipping, path drill was used. 7 mm path drill was used first, followed by 13 mm path drill. In the canine area, path drill was used up to 10 mm, and then 3.5 by 10 mm one-guided drill was used. Template was nicely fixed. Next is 4.0 by 10 mm OneGuide drill. In number 13, TS3BA surface 4.0 by 10 mm implant was placed. Cell line was applied in number 13 as 4.0 by 10 mm implant was placed. Implant driver and torque wrench was used to adjust depth and hex positioning. Primary stability was over 30 Newton centimeters. Number 13, position was checked. Number 22. As was done earlier, flattening drill was used, followed by initial drilling. Initial drilling was done. The bone was fairly favorable. 3.5 by 10 mm OneGuide drill was used. 3.5 by 10 millimeter. TS3 3.5 by 10 millimeter BA surface implant was placed. In number 22, the diameter was 3.5. Number 22 was completed. Moving on to number 23, bone anchor was removed. In number 23, implant placement preparations were conducted. Flattening drill was done before, but was done once again. TS3 BA surface 4.0 by 10 millimeter implant was placed. In the canine area, the implant was placed about 80% using engine. Implant driver and torque wrench was used to adjust the depths and hex position. It's over 30 Newton centimeters. That was how number 23 was completed. Moving on to number 26. Flattening drill with gold rim was used to do flattening. 3 millimeter stopper was used because it was assumed to be 5 millimeter. 2.2 twisted drill with a 3 millimeter stopper was used to drill 4 millimeters, followed by 2.8 by 7 millimeter with 3 millimeter stopper. In other words, a 4 millimeter drilling was done. 2.8 with 3 millimeter stopper. For final drill, 3.8 by 7 millimeter drill with 3 millimeter stopper. Drilling was done up to 4 millimeters. So we're going to move forward. 5 millimeter drilling was done using 2 millimeter stopper, followed by 3.8 by 7 millimeter drill with 1 millimeter stopper. So drilling was done up to 6 millimeters. Because 6 millimeter drilling was done, with the depth gauge, 4 millimeter stopper was used to check whether sinus flora penetration was done. There is no proper context, so the penetration was yet to be done. 7 millimeter drilling was done. 3.8 by 7 millimeter drill without stopper. I got the sense that the sinus flora was penetrated. Using 3 millimeter stopper with depth gauge, I confirmed there was contact, so it seemed that the sinus flora was penetrated. This was followed by hydrolift. 3 millimeter syringe with 2 millimeter of saline. You put in about 0.5 and do regurgitation and then put in some more. Aspiration was done again. Blood did not come out. You can see that there's negative pressure. This means that there was no sinus membrane perforation. You can see blood regurgitation. Bone graft was done. On bone carrier, EOS was placed. Bone condenser was used to perform bone graft. Lifter was used, aspiration was done. You could see that there's negative pressure and graft materials are concentrated rather than being scattered. The TS3 5.0 by 10 millimeter implant. The bone quality was quite favorable. The implant was placed about 60 to 70% using the engine. Implant driver was used to position the implant. In number 11, where the implant anchor was, it was removed, and in number 24, implant anchor was removed and template was removed. The implant placements were complete. Because there was a bit of defect in the anterior area, minor incision was made and a GBR was performed. In number 11, and the labial defect, AS collagen was used. Bone graft was done. In number 23 and 22, minor incision was given and bone graft was performed. There was a bit of labial wall left here. AS collagen was used here. First, a mini healing abutment was connected to number 22. And healing abutments were connected to the rest. Number 23, 13, 24, up to number 26, healing abutments were connected. After healing abutment connection, similar to dual zone concept, bone graft was performed. Suture was done. Flap was not reflected significantly, so it was sutured with a figure of 8 suture. For number 11, suture was done as well. Figure of 8 suture was done. Today, I wanted to highlight how vertical anchors were used in the case where there was distal free end to fixate the OneGuide template more surely. When you use lateral anchor, at times, because of compressed gingiva on one side, there can be deviations, but as shown here, in this case, I've used a bit more vertical anchors to highlight the importance of it. There was existing implant in the upper right area, and on the other side, in a symmetrical manner, in the canine and premolar area, bone anchor and implant anchors were used to fixate the template better. Thank you for watching.